Talking there, that story that you were running about how much you should drink during pregnancy.
Yes, and the report now is saying none at all if you're a pregnant woman, because it does risk lowering your baby's IQ.
OK, Dr. Ellie Cannon, our regular doctor, is with us. Very good to see you, Ellie.
Hi.
And from the Centre for Parenting Culture Studies at the University of Kent is the sociologist Jan Macvarish. Very good to see you, Jan. How does this affect you or interest you, Jan, as a sociologist?
Well, I think what's very interesting is that we have scientific research which seems to offer very, very strong conclusions about what people should be doing in their personal lives, and I don't think scientific research really should be doing that. And I think there's an awful lot of this kind of research at the moment that's bombarding parents with often conflicting advice.
But if it's bad for you or bad for the child, why shouldn't they be?
Well, because it isn't really evident that that is what the conclusions of this study are. I mean, lowering IQ by 2 points, possibly with certain lots of other different risk factors at play, doesn't really give us the kind of certainty that the scientists here are claiming.
And it must be a nightmare for people like yourself, Ellie, when people who are pregnant are looking for advice. I mean, the advice seems to change.
Yeah, I mean, I think that's true, and I think what Jan says in some way is right. There seems to be too much advice for parenting. But I have to disagree with her that we know already that a large amount of alcohol when you're pregnant is actually dangerous. I mean, more than 6,000 babies a year in this country are born with what we call fetal alcohol syndrome, which is obviously one extreme.
But do you know why people say, I mean, I personally think you shouldn't drink at all and drive. Why measure it at all? Just don't drink and drive.
Yeah.
Are you of that opinion when it comes to pregnancy?
Yeah, absolutely, because it's a risk versus a benefit. And even if the risk is tiny, what is the possible benefit to a pregnant woman of having a unit of alcohol a week? I mean, fair enough if it's a case of using a mobile phone or using something that actually improves your quality of life, but actually, why not just give up for 9 months?
But I think there are benefits to drinking alcohol for women who are pregnant, and each woman has to decide that for herself. Maybe not health benefits, but I don't think this is a risk of harm as such. This is not dangerous for babies, for women to have low to moderate levels of drinking, as is being claimed.
No, that's very interesting you say that. I mean, there are benefits. Like my wife, for instance, when she doesn't have a drink, she's not good company to be with. She only has a personality, really, when she drinks, and she's sociable and she's friendly. You deprive her of that in any amount, and it's a whole different world.
So much trouble
so what are you saying, that it can be a relaxant then for some people?
Well, I think obviously that's why people do drink moderate amounts during pregnancy if they keep on drinking. And I think even the claims of very severe harm are to do with very, very heavy drinking. This is people that often will die of alcoholism. So even fetal alcohol syndrome, which is the kind of big bogeyman that's raised here, is not really. We don't know that 6,000 is an actual number of cases. It's definitely alarmist, and it claims a degree of certainty that isn't there, and actually scientists should actually back off, I think, from giving women advice about how they live their lives.
I disagree when it comes to something. We have scientific proof. Different people actually digest alcohol in different ways, and we know this, for example, from different people who might take a paracetamol overdose, and you could take 30 tablets of paracetamol.
Well, we don't know which people are which at the moment, so it doesn't really help anybody.
So why take the risk? As a woman who's been pregnant twice, I don't know why anybody would take the risk.
But we take all kinds of risks when we're pregnant.
Would you take the risk, Charlotte? How would you feel if you find yourself pregnant now and hearing this advice today? What way would you lean?
Well, it's interesting, actually, because quite a few of my friends obviously have had children, and they have had the odd glass of wine, you know, during their pregnancy. But it would make you think again. But a lot of people getting in touch on Twitter today are worried about the fact they've had confusing messages. I've got one here from Mark Lambert. They've just had their daughter. He said, my wife was partial to a tiny drop of wine on an odd evening, and he's now worried about it, saying how much is too much.
Jackie, what did you do?
I drank when I was pregnant because it wasn't really an issue then.
But you didn't
it hadn't come out.
You say you drank, but you
yeah, I might have had a glass of wine in the evening or not. I mean, for one of my pregnancies, and I think this is the same for lots of women, they really go off alcohol. Just the taste and the smell is just gross. You cannot go near it for months and months and months. In one of my pregnancies, it was fine, and, like, you know, the midwife said, you know, you work hard. You know, it's quite hard for you this pregnancy. If you want to have your glass of wine in the evening as normal, just carry on as normal. The same as
the
go to the
doctor's
gym as
hair
normal.
has just gone curly at you saying that. It was straight when she came in
That's the
here.
midwife said to me. So, you know,
This is a non-problem
I
because you don't have more children around who are, as far as we know, suffering from either fetal alcohol syndrome or who are showing lowered IQ. We don't explain the differences in educational achievement by whether their mothers drank or not. Good schools are far more important than whether women have a glass of wine.
I don't know if I necessarily agree with
What
that,
about
but
things like nutrition and smoking and things like that? Surely there are things that are worse or just as bad than the drinking.
oh, absolutely. But as far as I'm concerned, both as a doctor and as a mum and as a woman who wants to live her life without sort of state control, to me it's a no-brainer. I mean, why actually take the risk? Is drinking so essential to your life that we have to almost have the discussion?
But recent studies showed that women who work late into pregnancy also risk the pregnancy. So do we say that women should stop working? What kind of conclusions are we supposed to draw from these kinds of risk factors? It doesn't help us to live our lives.
The evidence base behind this is real. We know that alcohol crosses the placenta. We know that babies who are not fast acetylators might suffer from problems from it. So, I mean, I don't see what the sort of problem is with avoiding alcohol.
Okay, if you have a problem avoiding alcohol, if you've got a say on this, get in touch with us at Eamon Holmes, at Sky Charlotte News, at sky.com. Ladies, thank you very much indeed. Sport follows the break. Jackie?
I have